Miss Brown.
Hi.
How are you?
Oh, not so good.
I understand. That's your mom, right?
Yeah.
Hello, Mrs. Brown. How are you?
I'm okay. Good to see you.
I know, it's good to see you. I wish it had been a better place.
I know.
So, let me get a chair. How is the pain?
I'm in pain. It's terrible, and I can't move my arm, so it's freaking me out. What's going on?
Did they give you the pain medication?
They did, but
It's not helping.
it's not really helping. I mean, it helped a little, but not that much.
Okay.
So throwing up. So sick.
You've been throwing up?
Yeah.
Okay, I will see if we can get something for nausea, something to help you with throwing up. Actually, the condition I saw you this morning wasn't really looking good. That's why I decided for us to admit you and run those couple of tests. The MRI we did this morning did not really give us a good news. Can I talk while your mom is here? Is it okay to talk?
Yeah.
Actually, the MRI shows that your cancer have spread to your brain. It's hard.
So what's gonna happen?
It's a difficult situation. After all those chemos we did last time,
You did that whole
and-
surgery. You
and
did
the
that whole
surgery,
thing.
we were
She
thinking
had
we
the
got
chest
it out.
tube. She had that months of pain.
I
And
understand.
didn't you say it was cut out? Like everything was
It
out?
was.
I don't understand.
The way cancer spread is so miraculous that sometimes you wonder, is this really a living? Is it like a magic? Any little thing that is left can just grow overnight. And from what it shows is stage 4,
Oh my
which
God.
is not too good. And the prognosis is very poor.
How long do I have?
I don't know.
Actually, from the literature and other patients I've been seeing, you have up to 6 months to live. But we can try another round of chemo.
Her. I want a second of it.
Okay.
I just.
What will happen is I will make sure we get you comfortable, and I will let you discuss options with your mom, and I will leave this pamphlet here for you to read, and I'll come back later to talk to you guys. I'm sorry.
I don't know what to do, Mom. This is a palliative care brochure that she gave me, and it says I can still have a morphine-resistant pain and suffer personality changes.
I think you're just reading too much into this stuff.
Mom,
I think
don't
we have to
wanna
just
do
listen.
this.
Let's just take one step at a time. We can just get this pain under control. I mean, you've been so sick and then throwing up. What if you didn't have that? What if they could cure those symptoms?
Mom,
Then you could feel better.
it says morphine-resistant pain. What you gonna do about that?
I don't know. I mean,
pain
you don't even
medicine.
give this a chance. Like, you have to meet these doctors. They're called palliative care for a reason. It's comfort care.
Isn't there just a pill I can take and just die?
That's not
That's-
what you mean.
That's a good idea. You know,
I
what?
raised
heard,
you different than that.
Mommy, I heard
No,
about that
because-
place in Oregon.
Yeah, but what you're talking about, that's suicide.
Can we just go, Mom? I can't do this anymore.
Let me get this straight. So you want me to take you to Oregon and you think they're going to give you some pill on Oregon?
Yes.
In this condition, that's what you want to do.
Yeah.
I think that you're not thinking straight. Just already from what they gave you this morning.
Mom, please.
Don't you
I can't
see how
do this.
crazy you're talking? Don't you understand this against what Jesus taught us? This is
Mom.
not how we raised you, your father and I. You're Jesus' child. This is not how we raised you to be. You have to fight for each day. It's a gift from God. And you can't just say, I'm going to take a pill and throw it away.
Okay. I'll try. I'll try.
I think you just have to not feel so sick for a little bit. This is all new. I can't even get my head around this diagnosis. I think we're both in shock. I think you just need to give it some time. And I think you need to think about all those days we sent you to church. And you need to think about that. I don't see how that doesn't give you some strength.
Mom, you're not the one laying in the bed with your arm not moving.
I'm sorry, you're right.
Hello.
Hi.
Hi, Miss Brown. I came with the palliative care nurse because your nurse that took care of you this morning expressed some concern. Overall, how is the palliative going?
It's not good. I'm vomiting and I'm in pain and just I can't do this anymore.
She did mention to me about you and your mom discussing about going to Oregon to get the pill.
Yes.
And it sounds kind of too much for us to take right now. Do you feel, are you depressed?
I am not depressed. I'm suffering. Can't you see this?
I
My
understand.
arm still is not moving. I'm vomiting. I can't take this anymore. Can't
So-
I just go and take a pill?
It's okay to feel the way you're feeling. I understand your situation. That's why I brought the nurse here so that she can talk to you about more of the palliative. Maybe we may have to discharge you home and she will tell you more why we're here.
I'm sick of this palliative.
Miss Brown, I'm Nikki representing Palliative Care. Is it your pain that's giving you grief? I can look at your pain management and be more aggressive with it. If it's your nausea medicine, there are other medications around that we can use.
Why didn't you use it before? How long am I gonna be like this? I'm in pain. I'm vomiting. My arm is not moving. I can't even get out of bed.
One thing that we can do is we can sit together with with you or your mother if you wish to represent you and your other providers, and we can discuss the plan of care for you. So we can honor your wishes.
Do that. I just wanna go. I don't wanna do this anymore.
Okay, and another thing is, sorry to cut you off, about the pill you're talking about. We don't do that here. And for you traveling to Oregon, we don't think it will be safe for you to travel to Oregon. But since this is kind of a difficult situation to determine which one is good, we'll set up an ethics committee where we'll invite the chaplain, other members of the healthcare team, and we'll discuss the better option for you.
I don't care. I just wanna die.
Did your mom went home or is she coming back?
She'll be back.
Okay, we'll tell the nurse to get a time that will be appropriate for you. Can you get the nurse? Hello, good evening everybody. I'm Dr. Jones, taking care of Amy Brown, and I brought her case to ethics committee to discuss her option. She's been requesting for assisted suicide, and there's a dilemma between me, the palliative care nurse, the mom, and the whole medical team taking care of her. And I feel the best way to resolve this is to bring it to this committee.
I am Nikki from Palliative Care, and I am in this meeting to present the case on pain control and symptom management in the case of Miss Brown, and to offer other possible solutions or alternative as opposed to ending one's life.
Okay, well, everybody knows that I'm her mom, and you know, I'm a Christian person. This is really, it sits very badly with me, the whole idea of this, because I believe in an afterlife. I believe in heaven, and I believe in hell, and I believe that Jesus forgives, but I don't think he forgives this. So I have a lot of trouble. I think that she's in a health crisis, and that we have to get her through this, and that we can't just throw out our beliefs. And we raised her as a Christian person.
And I'm Emily. I'm the chaplain here, and you know, I'm here to show the spiritual component of all this. I think obviously the patient's position, if she really wants to do this, is the complete opposite of how she was raised and how her mother feels. So I think this is putting her and her mother in a really tough spot spiritually and emotionally. So I think we have a lot of work to do here.
Okay, we start actually the Code of Ethics concerning the medical practice, the AMA Code of Ethics, is against physician-assisted suicide, known as euthanasia. In another way, the patient is still competent. The patient have the right to make decision, which brought the issue of autonomy. And if we are to respect patient autonomy, we have entered a slippery slope. We don't know which of the evil, which one is better. And when we look at following the Code of Ethics and the principles of ethics, as a medical doctor in my practice, we took an oath of doing no harm, which is beneficence. And I've been thinking about this and trying to consider, am I harming the patient by giving other options, or am I violating her autonomy by refusing assisted suicide? I have brought the palliative involved, and they've been doing all they can, and I will let her talk from her own view.
Ms. Brown, in this scenario, who determines quality of life? And of course, only the patient can determine quality of life. There are alternatives to physician-assisted suicide that are ethically supported and legally allowed by American law. They are the proper pain management and the foregoing of life-sustaining treatment. Your daughter has mentioned about the state of Oregon and that the Death by Dignity Act, where physician-assisted suicide is allowed. I would also like to point out that of the 1,100 prescriptions that were filled, only 700 actually took the pill.
The suicide pill.
Yes, ma'am. So 1/3 of those were saved. That leads us to somehow conclude that there are patients who cry for suicide because it's a cry for help. They just don't want to know. They just don't want to be alone when the end is near. They do not want. They want the assurance that they will be comforted, that they will not suffer through.
That's the purpose of God in our life. I mean, God comforts us.
Right.
She's never alone. She has Jesus. And I don't know why she has forgotten all of that. I know she is suffering and that she wants to stop suffering, but I wish there was a way to get her back to that place of faith, because I think I raised her this way.
I mean, I can go in and talk to her about her views of the afterlife and support her in that way.
Or if you have a specific priest or chaplain that she feels closer to and she might open up.
I think that this would be good to start with. I think you have a good rapport with her. And I don't even worry about like these palliative care measures, because aren't you like shortening her life if you say just really turn up the gas and just start giving her all these pain medications? Aren't you shortening her life with that too?
No, ma'am. The American Medical Association and the Association of Nurses, the ANA, it is permissible to provide pain management, pain control, even if the end result is death, because the intention was to treat the pain, to alleviate suffering. It was never the intention to hasten her death.
Okay.
Like I said, she has the right to intensive pain and symptom management, to forego life-sustaining therapy. If all else fails, we can do what you call sedation to unconsciousness, where we administer sedating medications to decrease her level of consciousness to mitigate the experience of suffering, but not to hasten her death.
You know, it's just like the problem here is that she's such a young girl. I mean, she has so much about her that's like healthy and vibrant. And then like this other part of her that's just failing, and I don't know. I don't even believe that you can tell me she has 6 months to live. Like, who are you to say that? Like, God is the only one that can really tell us when our time has come. I mean, I could go out to the parking lot and it could be my time. I could get hit by a car. I mean, I think that these kind of statements that doctors make is like, you know, kind of wrong because you're giving her these limits on her life.
Mrs. Brown, you're right. We have to say what we have seen. Is according to the code of ethics, we have the duty to say the truth, which is veracity. And according to the literature and our practice and the lab tests and results that came up, that's the estimate. What we say is estimated time, not a pinpoint time. She might live till the next 2 years. She might live maybe before the six months, but I owe her a duty to tell her the truth and only but the truth.
Based on your statistics.
Yes.
That is correct, and she does not have to be a statistic.
I mean, do you have faith? I mean, where do you come from with this? Like, do you think God directs your practice of medicine, or do you just think like science is just existing in this vacuum? Like, I don't even understand. I mean, I'm a person who reads the Bible. Like, I believe in that. I believe in Jesus. I really do. And I think that, you know, that we're children of God, but we express God when we express love. We express God when we express forgiveness, but do we express God when we manipulate, you know, the universe in this way with chemicals and different things? I'm just having trouble wrapping my mind around it.
Well, Miss Brown, sorry to interrupt, but do you know how your daughter feels about the afterlife? Have you discussed that with her?
I tried. I just think this is what I think. I think she's lost her will to live.
Okay,
And-
Miss Brown,
Yes.
I can.
Do you think she's depressed?
I did ask her about depression. I think another thing we can do is consult psych to evaluate her. And as we are now going into more aggressive palliative, and I see you're in the hospital every day, I think the best thing we'll do is get your home environment prepared and discharge her home. Even if most patients I've taken care of have more peace when they are home in their quiet place. That will give her friends and other family members time to come spend with her. I don't know
Sounds
if
like
that.
a good idea.
So we'll end this here and we'll plan of sending her home. The palliative care nurse will work with home health and they will get your home ready. And before we send her home, we'll talk to psych. They will come see her and the case manager will plan everything. Miss Nikki, do you have anything to say?
I would like to see her another chance and
you
see.
have to talk to her too about this organ idea. I mean, you have to talk to her about this. I mean, how crazy it is. I mean, I looked this up myself. You know, I mean, you know how I feel about this. It's totally against my belief system. But another thing is that I think she thinks it's like this magic pill or something, and it really isn't. It takes a really long time, and the state of her health, I mean, this I like. This sounds to me like you're making her human again. She's going home. I mean, you're talking about putting her in a coma in the hospital. I just can't even bear it. I like this idea about going home, about being more normal. Maybe she'll remember some of her beliefs when she gets home.
Okay, at this point in time, we'll end the meeting, and as it stands, we'll talk to her, and the plan of care will be to send her consult psych consult,
Okay.
palliative care, case management, and she will be home. Today is Wednesday. We'll be working towards sending her home by probably
Friday.
by Friday.
She
if
agrees. You have to
She
see if she
agrees.
agrees.
And another thing, I will talk to her, and for you, traveling is not an option. She is not safe to travel.
Okay.
She cannot even travel in your car. We'll arrange for transportation to take her home. and we'll set up the oxygen and all that is take. Anybody have any question?
Well, I just wanted to say, I'll go and talk to her and continue to talk to her about her beliefs of the afterlife and make sure that she's spiritually in a good place for all this as well.
And palliative care would handle pain management and symptom management to make sure that she is comfortable and that she has everything she needs when she gets home.
Okay.
All right, thank you, ladies.
Thank you.
Thank you.
Good to see you, and hope this work well
Works
for
out
us.
good.
Yes, God bless.
Hello, Miss Brown.
Hi.
How are you? Good to
you.
see you.
Reading your Bible.
Yeah,
What are you doing here?
we're doing a little dedication for maybe 3 months now.
That's true. How did it go with hospice?
Oh, it was really rough actually. She never regained like her will to live.
Sorry to hear that.
She just like stopped eating. She got totally fixed on that idea about kind of controlling when she was able to die. And I'm just praying. I continue to pray because I don't know how to feel about it. I don't know if I'm gonna see her.
I'm sorry you have to feel that way.
It's okay. I have Jesus, so thank you though.
It's
And
nice to
I
see
have-
you remain
I
strong.
just have my questions, but that's what life is. But thank you, ladies, for all your help. I'm gonna go because we're doing the dedication. If you want to come, we're doing it. It's happening in like a half an hour. Okay.
Take care.
On the side of the garden.
Take
Thank
care.
you. Dr. Jones, can you believe it's been 3 months already?
3 months already. Times fly.
I know.
And
Sure does.
her mom is so strong. Coming to think about this, I'm wondering if I should reconsider assisted suicide. I think it's something we have to see if we can put in our practice. Having to see her pass through
In
this.
Virginia?
Yeah, somebody can push
You lost
it.
your mind, Dr. Jones. Did you think about the potential for abuse if that happened?
There's always
Patients
a
can
way
be
to get
forced to,
around.
family members can force patients to take their own lives to save money.
Do you consider her passing through, have to stab herself to death despite all the hospice, palliative, and her mom suffering to see her go through that way?
Well, did you ever think about if we allowed voluntary euthanasia in the state of Virginia? The 14th Amendment of the United States said whatever you allow for competent individuals, you need to allow it for those incompetent individuals. And they would be at a disadvantage. It will lead to involuntary euthanasia,
now,
Dr.
who
Jones.
determines who is competent and who is non-competent? Everything have a way of getting around it. What about for critical ill patients?
We can
like
do palliative
any.
sedation. But they did not want that. They did not want that. She wanted to go home.
It's something to ponder. It really bothers me. I think it's something we have to go and reevaluate and see how to make this work.
Well, I understand where you're coming from. When I went to practitioner school, and I understand on the grounds of mercy, justice, and kindness.
And autonomy.
We don't, autonomy, yes, we do not want patients to suffer.
Exactly.
Right. But it's this whole slippery slope process.
It is.
That, well, I guess that's why there's really no right or wrong answer to this.
I believe. Actually, we'll keep doing what we're doing and believing or hoping that it goes well. Life comes and
That's all we can
Anyway,
do.
I have
Okay.
a call. I have to go see one of the patients immediately. Always
Take
nice
care.
to see
Nice
you
to
and
see you
nice
too.
working with you.